Most recently, and for at least the last last 2 years, has been in charge of running the Border Infectious Disease Surveillance Program. And as I said, valley fever knows no borders in this part of the country, and it's been an important focus of that group. And today he's going to talk about border health.
I'm not a clinician, I'm an epidemiologist. I track outbreaks of disease, determinants of disease, and I like to study the science behind public health. We know that we have a lot of valley fever here in Arizona. This map is from 2007 when we had some additional funds to do some more in-depth analysis of valley fever. It shows the number of cases per 100,000, so it is a rate. And you see that most of the valley fever here in Arizona comes from the southern border, and even more so from Maricopa, Pinal, and Pima counties. So we're right in the thick of it. Where it is really close to the border region. This is valley fever in the US, but I have to give a caveat to this that the last time that we had a study of this proportion was 1957. And that's where this data comes from. It comes from a test that we no longer have, but a skin test to establish if people were tested, or that were exposed, not necessarily an infection, but this lets us know that we're really in the heart of where this valley fever is. Yet, our neighbors just to the south have the same thing. And as has been discussed several times, infectious disease doesn't see that border. So even with diseases with this that wouldn't be spread person to person, but are throughout the soil in Mexico and Arizona, there's a lot to be learned in Arizona and collaborative in order to really do our best to control and make people aware of this disease. So wrapping this all into how we're moving forward to the entire border region. In 2006, 2007, kind of when I was first starting along some of this path, we had some meetings that were between Arizona Department of Health Services and Sonora's Secretariat de Salud, their state health department. Discussing the importance to this, they were passionate about wanting to know more about valley fever, and they said, but wait, we don't have capacity to test people for valley fever here. In 2009, within the respiratory disease work group, they identified that this was something that we were all going to try and work on across the border. And we identified it in our matrices that kind of guide where funding and program planning go for public health. At this time, I'd like to ask my esteemed colleague, Dr. Julie Harris, to step up here.
Thanks, Orion. And in collaboration with the groups in Arizona and New Mexico that are trying to help Mexico come up with a surveillance system for cocci, we went down, myself and another colleague who works in the laboratory, to help train them on how to do one of the diagnostics for cocci. So hopefully between this laboratory collaboration, between the work that Arizona and the folks like Orion are doing to help them build up their surveillance system, pretty soon Mexico will also be able to have their own numbers, just like Arizona and just like California, to try to evaluate how much cocci is actually happening in the country of Mexico.